As of Friday morning, San Diego County had administered at least the first dose of COVID-19 vaccine to just over 40% of the eligible population, and the county is just shy of having 25% of residents fully immunized. But one of the big issues at the moment is the gap between supply and demand, according to Sharp Healthcare COO Brett McLean.
It looks like this week's going to be a little bit lower, unfortunately, for a couple reasons, but then actually will probably go up in the next few weeks. But we are receiving and administering anywhere from 25,000 to 40,000, probably at the high, on a weekly basis.
Sharp Healthcare has 5 public vaccination sites across the county, including the Superstation in Chula Vista. While they haven't had to close down many of their sites due to vaccine shortages, they also haven't been able to expand their capacity. But McLean is still optimistic that Sharp is well on their way to vaccinate upwards of 1 million San Diegans by the end of the pandemic.
We have today we will likely pass 400,000 total doses that we have administered, and that's about 160,000 fully vaccinated.
California's allocations of the Pfizer, BioNTech, and Moderna vaccines are expected to remain relatively steady through the next week, but a recent mix-up with a batch of Johnson & Johnson is causing a nearly 90% reduction of those vaccines in the state next week. The week after, California expects to receive an even smaller allotment of the single-dose shots.
It looks like there's going to be somewhat of a less allocation for the whole state, and then San Diego ends up getting a percentage of that.
McLean said the vaccine allocation should pick up beginning the week of April 22nd. In the meantime, COVID-19 vaccine eligibility will expand to anyone 16 years or older starting April 15th. In California, plans to end nearly all COVID-19 business limitations on June 15th, provided that vaccine supply is sufficient and hospitalization rates are low and stable. Jacob Aere, KPBS News.